All right, it's a beautiful Monday morning right here on the Remedy Dial Solutions 93.9, the 15th day in the month of July 2024. I hope you're already having a wonderful start off of the second half of the year. Welcome to Solutions Clinic this morning, where we get to talk about everything and anything health. I hope you had a wonderful weekend. My name is Vic Riches. This morning, we're going to be talking about hepatitis, and we're going to focus on hepatitis B virus. By way of introduction, hepatitis B virus, HBV, is a DNA virus that primarily targets the liver. It's a major global health concern responsible for a significant proportion of chronic hepatitis cases. The virus is transmitted through contact with the blood or other body fluids of an infected person, commonly through unprotected sexual activity, sharing of needles, or from an infected mother to her newborn during childbirth. HBV can cause both acute and chronic infections, with chronic cases leading to severe liver conditions, including liver cancer. Vaccination has been proven effective in preventing HBV infection, contributing to the ongoing efforts to control its spread and impact on public health. Joining me this morning for this conversation is Dr. Chukwuma Okoli. It's great to have you, Doc. Good morning to you.
Yeah, good morning.
All right. So it's been said that HBV virus is more threatening than HIV and AIDS.
Very
How true is that?
It's 100 times more effective than HIV and AIDS. Yes, hepatitis B virus is
More threatening.
to be feared. Yes, it is. It is 100 times more dangerous.
How so?
Okay, now this is it. While you were giving us a preview into the discussion, you mentioned body fluids. I would use examples that people can relate with. If anybody in this room has HIV, I can hug the person, I can shake the person, I can take spoon from the person and eat the food the person is eating, and I won't be afraid. But if anybody in this room has hepatitis B, I will not touch. If that person is in his or her infective stage, even her sweat can infect me.
My goodness, now that you mentioned spoon, I'm scared and worried because even in work environments, you share spoons with your colleague. I'm not saying any colleague of mine has HPV, but it's even more scary now. So
infective stage, only in the infective stage. But
you can't know this. Nobody tells you that they are in the infective stage.
Exactly, that's just it, and that's why we say it is 100 times more dangerous than HIV. So people should be aware first that hepatitis B virus is present and highly dangerous.
My goodness. So let's talk about items that you share with people.
Okay.
Is there a way that can be avoided? Let's use the spoon because I think it's very common, especially in workplaces. You buy food and you don't have a spoon. Your colleague has one. You take it from the person and you wash the spoon.
Oh yeah.
If you do that,
yeah, you're free.
You're free.
Yes, you are.
Fair enough.
Yes, most of those viruses can't withstand soap. Soap
Okay.
will just destroy the virus. Yes, so washing. Just make sure you wash the spoon. These are the things called universal precaution. You pick up a piece of spoon, you wash it and use it to eat, you're good. And you don't just wash with water, soap and water.
So people who use tissue paper, for instance, to clean the spoon,
that you did not wash with soap and water.
they do that. It's in their mind. That's a way of cleaning the spoon. So there's no soap and water, but you have salvia or tissue. You just clean it up and you start eating with
Keep it up.
Continue. He said, keep it up. It means that you should not do it. So he's not encouraging such behavior. Well, I think now I can agree that is scary than HIV or life-threatening as it is.
Yes, it is.
And, I mentioned that you can't even know that someone is at his infective stage.
Exactly.
So are just symptoms that I could see. I'm not saying you should start labeling people by saying symptoms, but it's happening to someone that you know, what are the
The,
symptoms that you see?
the commonest symptom you can relate with is yellowness of the eye in an adult.
Hmm.
Jaundice in an adult. That most likely will point you to hepatitis B. And then after some time, the yellowness disappears. But at least there will be a point when the adult appears and adult is all yellow.
Hmm.
It is at the infective stage, highly infective stage, and should be avoided. In fact, I remembered a friend who turned out yellow, and then I asked him, "Why did you come to work? And you work in an hospital, in the account department, record department rather? You know, only for one consultant should see him, and then he's raised the alarm. Why? Fine, we didn't explain because we don't want to stigmatize. But all we said is, go and rest. I mean, you're just recovering. You go and rest. But the real truth is, don't infect people.
Hmm.
Go until when you are done with this stage.
Yeah, this is serious. You know, for most people, I think they know that HPV is usually from the assumption is usually from sexual activity.
That's the commonest contacts people have these days.
Hmm.
That is it. It's the commonest contact people have. The annoying thing is that you just get a lady, and the next thing you guys have one kind of connection, and you don't. That's all. Once that connection occurs, every other thing goes out.
But this one is not even a functionality of using protection.
No, what
right?
I know, sure, of course. If the one of the partners is in the infective stage, then the other person is at risk. But if the partner is not in the infective stage, yeah, it's only when there is no protection that the second person is at risk. Yes.
And you know, it's been argued, you know, over time until we got clarity that, you know, kissing HIV, you don't contact HIV via kissing.
Yep.
So in the case of HPV, it's a clear road.
Well, the virus is not readily transmitted through
Saliva. Okay.
Most times.
Is that not okay? That's not bodily fluid.
It is a body fluid, but through the sweat is more common. The fact the sweat of an infected person who is in active stage is highly loaded with hepatnaviridae virus. And the truth is, you don't know which stage such a person is, so it's best to use universal precaution. So if anybody turns up, for instance, in my office now, of course we attend using gloves. Okay, because we don't know which active state the person is. And if you happen to have attended to anybody without gloves, it's simple. When you're done, there's a wash hand basin. Go wash your hand with what? Soap and
water.
And after that, there's hand sanitizer. I don't know why hand sanitizer have disappeared. Please get it. Get it. This is a public place. The studio is a public place. And so once you come in, you just grab, apply, because you have touched the door handles and all that. Apply it and then sit down. Once you're done, you're stepping out, apply again. At least it protects you while you step out.
So even touching hand knobs or surfaces, let's say an infected person sweats is on these surfaces, you can get it.
Yes, you can, because hepatnaviridae is very stubborn, doesn't die easily. Doesn't die easily.
Wow.
Yes, it's a very stubborn virus and very strong one. That's why they say it's 100 times more dangerous than HIV. But you see, everybody talks about HIV because HIV dries that person up. And they'll be like, hey, DTMU, because he dries up.
Right.
What about hepatitis B, that the person will just have a liver failure and just die off within 3 months?
That's the time span?
Yep. Once the liver shuts down, within 3 months, they're gone. We've managed a couple of cases whereby once they come in like that, you look at them, you're like, wow. This person is already down with liver failure from hepatitis B. 3 months, they're gone.
Unbelievable. Let's talk about the stages. How does it vary in each stage?
Okay, basically, of course, we have, like I mentioned, the active, first of all, the infective stage where the virus inoculation occurs, and then after a time, the person will develop the high-grade temperature that doesn't respond to any form of analgesics or antipyretics. And then after that stage, then the fever breaks by itself, and then the jaundice appears. So most times it is when the fever is currently there, they run as much as 38 degrees or even more. At that time, some get to the hospital. Those who don't feel they should go to the hospital stay at home and get treated at home. And then the nurses who are treating them are also at risk, because those ones are just called to treat. They don't even know that the person you are treating is actually undergoing hepatitis B infestation. Okay, so at the time the fever breaks, John disappears. And then they will now start saying it was probably the drug they took that brought it out. You see the ignorance in the society. So by the time they tell you it is the drug they took that brought it, you're like, which drug? I said it is those drugs. Okay, you know what? Let's go and run this test. So that's another stage when the John disappears. Okay, and then after that stage, they have the virus, and then they are no longer infected by then. But the virus is there, so it can only be transmitted now through the semen and the vaginal fluids at that point.
You know, you mentioned that it's just the yellowishness of the eyes.
No, there are other symptoms. So we have fever, we have muscle pain, generalized muscle pain, weakness, and then the urine is colored reddish brown and all that, myoglobinuria and yes. But the ones that people can relate with that may likely point you. It is not that every yellowness of the eye in an adult is hepatitis B. We also have CA head of pancreas. We have various liver conditions that may present with jaundice. But it is ideal that you must rule out hepatitis B infestation by quickly doing hepatitis B surface antigen test. So if it is negative, you know, okay, this person has a primary liver condition, but it is not caused by hepatitis B. Then you now have to look for what the primary cause is. It's just that with the rate of the common prevalence of hepatitis B nowadays, it's important that you rule out that one first before any other thing you want to do with a jaundiced patient.
Fair enough. The vaccine is said to be a major way of building immunity.
Yes.
Let's talk about the potency of the vaccine and how important
Thank you.
it
I'll
is.
first start with that of the children, okay? If you're listening to me and you're pregnant, have you done hepatitis B surface antigen test? Okay, you don't remember surface antigen, just say hepatitis B test, okay? Go get it done. Okay, it's part of the routine test. We also have hepatitis C, we have the HIV, they are part of routine. We call it strip test in our side, okay? Get those things done. And if your hepatitis B is positive, just make sure you save up some money because the vaccine for the children is quite expensive. Yes, yes, I wouldn't want to mention any figure, but it's quite expensive. And let me say this funny thing. If such a person puts to bed by vaginal delivery, the vaccine is more than the amount the person will pay for the delivery and the services. Yes, it's very expensive. And that's why I say, if you know that you have it, please make sure you save up the money because that child must receive that vaccine before 72 hours. Fine, that is the uppermost limit, but make sure it is given within the first 24 hours of life.
Okay, the vaccine is after delivery for the child.
You inject the child, yes. You inject the child immediately the child is born. After, our own side, once we clean up and, dress up the next part of, after vitamin K and some other immunization, we give the vaccine to the baby immediately. All right, that's for the newborn. Then we have vaccines for adults too. In fact, vaccines to prevent, not vaccines to treat. Okay, so we have vaccines to prevent, which is routinely available. So find out from government facilities, that is where they are. And then they will tell you the number, the period you're supposed to take them. Make sure you complete your vaccine. So if you're at your free time, just check any major health center around you and request for hepatitis B vaccine. They will ask you questions. They will test you to be sure you don't have, because it doesn't make sense if you have the virus and you're not taking vaccine. Vaccine is actually an attenuated, it's a live attenuated virus. And then you're someone that a person already has the virus, now goes to collect more virus.
It's more virus.
Exactly. So what the vaccine does is that for a clean system, I don't have hepatitis B now. If I collect the vaccine is a live attenuated virus. Its ability to be virulent, to be destructive has been removed. You now inject it, and then my immune system sees it. What is this? And then they build soldiers to, like, oh, yeah, and then they eventually destroy. After destroying, they're like, where are they? And then they will wait. They will wait for life because nothing will come in. Do you get? But at least the immunity is already built. That's how vaccines work. They spotted it and they quickly produce the exact type of immunoglobulin that will destroy it. And after destroying that one, they are still waiting for more, but more won't come. And so you are now immune, and then you take them at various stages for a number of times.
So there are dosages like COVID.
Yeah, think about 3 times. It's given like 3 times, and then once you're done with that, and then you can now do booster doses, depending on the kind of work you do. If you work in a public place, make sure you visit a place where you can get those things done. from time to time. If you work in a public sector, people like us that work in a hospital, we make sure that we vaccinate ourselves well. Though sometimes medical workers can be very negligent.
Yeah. Is it potent for life? Because you find that when people, get these vaccines,
Yeah.
they somewhat decide to now live carefree.
Ah,
I'm just saying. So is it
you're right.
potent for life? Because the way you're saying it now, you booster doses. Someone will say, okay, let me just get the vaccine. I'm now cleared. I have clearance for anything.
If you feel because you have received the vaccine and you now get yourself exposed by being reckless, you will come down with the virus. For such a person, the liver will go down faster. So be careful.
Sounding like a threat.
Okay. I'll rather threaten now because it's for your own good.
My goodness.
At least if you learn the right thing and avoid trouble, you'll live long.
Fair enough. The virus can be transmitted to a baby via the breast milk. Assuming, a pregnant woman after delivery, maybe she didn't even do the test. And after delivery went home. So at the point of breastfeeding the baby, is it when the child gets the virus or during delivery?
During the process of delivery.
Oh, wow.
Yes, because the baby traverses through the vaginal canal. So it's true during the process of delivery, the child swallows a lot of stuff from the maternal vaginal passage or the birth canal, so to speak. So apart from breast milk, now through the birth canal, it's even HIV through the birth canal. Yes, it's also a means of transmission. And that's why you see in both cases you tell them, okay, nevirapine, okay, hepatitis B vaccine, let it be administered within few hours of life. Once they come out like that, you have to quickly administer. And once you do that, you can now decide, though HIV virus is weak in breast milk, so it doesn't last long when you expose the breast milk, so they can still breastfeed so long as the mother is on medication and the baby is on medication. We've seen people like that who have nursed their babies and the babies did not come down. And we've seen people too who had hepatitis B who breastfed their babies and the babies are. I know someone that has had 3 kids and the 3 kids are clean. But in her case, I think she's a carrier because the husband has been negative right from all the while and he didn't take anything. He didn't take any vaccine. So she's the only one positive. 3 kids and the husband are all negative. So. But of course, the kids were vaccinated at birth. We didn't take chances for that.
The vaccination, you said for children is quite expensive.
Yes, it is.
For adults,
It's affordable.
it's affordable.
Yes, it's just that the vaccines are not readily
Available.
So you have to go probably register, indicate your interest, and then come back and have it. They'll give you a time. You come back and you have it.
Well, is there a reason why it's not available at demand?
Well, yeah, it's not all those vaccines are readily gotten. And of course, they are produced outside the country. They're not made here. They're not made here. And the fact that it has poor, how do I put it, awareness, the awareness is poor. Doesn't make, and of course, most of these things are made available by donors with funding. So you just have to prioritize where there is high demand. For instance, the HIV drugs, there are a lot of HIV infected people living with HIV in the society. So you see those drugs are available. TB drugs are available because we have a lot of people who go for treatment.
Yes.
Unlike hepatitis B, that the awareness is even so poor. Some people still don't know what it means. You tell them, they tell you hepatitis, and you're like, huh? What? Come on. Something that is worse than even the HIV you're talking about. They still don't know about it. How often do we get awareness and all this? You see, people are the ones who are educating themselves. People like us who have chosen to be on the side of educating people, informing people, are doing it via social media and some other handles and media houses and all that. How much is the government doing? They are busy doing what? I don't know.
Government, I hope you're hearing. I hope you're doing something. Because this is quite serious. Even for me, I'm just getting new revelation to this. I know that it's threatening and all, but some revelations I've had this morning, it's scary. But this is not to scare you, but rather to inform you to apply caution and precaution in your daily activities and daily life, because that's the only way we can stay clear and free of this. Let's talk about the severe and chronic stage that leads to the liver failure.
Yes.
I guess my question is, at that point where you're experiencing the yellowishness of the eyes, do you feel any sort of pain that, because is it possible to, in that stage, you just assume that it's a normal thing that will come and go? Maybe, you had you had little sleep, so maybe that's why your eye is a bit bulgy and yellow. So do you feel any sort of pain that triggers and informs you that maybe I should go to the hospital? This is getting more worse than I assumed.
Yes, those symptoms that will make you get to the hospital are the fever that doesn't go down with paracetamol and may last 2 3 days
Oh.
exactly. And then that's when the pain comes, the muscle pain, myalgia, and then myoglobinuria, and so on and so forth. Those are the times that the symptoms make them. Most of the times when they come down with the yellowiness of the eye, that's the only symptom. It doesn't come with any other symptom, as it were. So it depends on their perception of staying healthy and staying safe. So most times it is their perception that will determine if they want to visit the hospital or not. But it's always ideal. Like I would say this, when people come to me and tell me they want to run tests, I quite understand. People respond faster to running tests than taking medications. Once you tell them you need to run this test, you need to do your cholesterol level, they want to do it, they want to know. When you tell them you want to treat them for something, they'll be like, there's nothing wrong with me, I'm fine. But after they have run the test and they now see that from this test, this came out, they now start paying attention to what you're saying. So it depends on the individual perception. So, please, we're not here to threaten you. We're only educating you on how it's a dangerous discussion. So by the time I got the message that it's hepatitis B, I was like, it's going to be a dangerous and scary place to talk about, because it is scary. It is. Don't just get into somebody and you guys are just getting down with yourself. You don't even know. I mean, you met somebody you're dating. Please, can't you just say, okay, please, you know what? Why is hepatitis B still spreading? It's not because boyfriend and girlfriend have refused to do tests to know their status before they started having unprotected sex. And people just get down with
Is it even customary with us to do tests? We don't, for malaria. Like, we don't even do tests for as little as malaria is, or as cheap as the test would be. We don't do tests for that. You just go to a pharmacy to get drugs for it. So let alone hepatitis. It's not like the test is free.
It's not free. It's affordable. It's not free, but it's affordable, and that's why it's ideal that you do it. If you care about your health, as a woman, you care about your health. You are informed about these things, and then somebody comes to you. Even if you eventually develop interest in that person, shouldn't you say things like, "Can we check ourselves and be sure we're cool?" It's not too bad. It's not. But I don't know. People just allow love to enter into their head. Is it hard then? I don't even know which of them. Just do test, I beg. I don't even know what to say. Do the test, please. They'll call it, babe, let's go. Let's go to the hospital. We want to run this test on the two of us. Why didn't you tell me we are coming to run test? Let's do it. We need it. Let's do it. At that point, the guy will agree. If he's clean, then why is he afraid?
Actually,
Most times you tell me, let's do test, and then they'll tell you, I'm not doing anything. They're afraid. Yeah? You know, Yorubas are saying a person will shop for food, may hand this man.
that's true. So let's paint a scenario after the test. Two boyfriend or a boyfriend and a girlfriend went to the hospital to do a test, and they realized that one person has hepatitis. What's the next line of action? Is there treatment for this?
Thank you.
Is there moving forward from there?
Thank you. At that point, you educate them. The decision is theirs. Some people love their partner so much they are willing to go all the way. Well, just advise them to get vaccinated. Some people actually hepatitis B positive by being carriers. Some can infect, some can't infect. I told you about someone I know who's got 3 kids. The husband is negative and the children are negative, though those children had vaccines. The husband is negative and she's positive. So just give them, lay all the cards on the table. Don't keep anything back. Let them know the pros and the cons of it. Yes, it's better that way. Every prospect that has to do with hepatitis B, educate them. You can even give them things to read about it. Let them know about the consequences. If they decide they want to go on, wish them well. and then that is you. You have done your job as an health professional. That is it. But if they've not really gone far into themselves and somebody wants to opt out, please let them opt out. They have a right to. It's their life. But you must let them know the consequences. You must let them know the complications that comes with hepatitis B. But it is not a death sentence. We've seen people who have it who are still living well because they have followed advices given to them by the physician and they are living healthy.
The way you say it, it comes off as though even people with that doesn't deserve love because everybody will run away from them as it is. So there is no treatment or cure for hepatitis B.
There is treatment, but it has no cure.
It has no cure.
Yes, but there is treatment for it.
Treatment to keep you alive.
Healthy, yes, as long as you can. Manage your liver and then live healthily. After all, people with it are living their fine. Like I told you, they're doing well. They're doing well. It's just that let's avoid new infections, but at least for those that have it, they are living their life and they are doing well. And the knowledge is available on the internet. Everybody should be aware of this now. It's not like we're coming here to tell you things that you don't know about. It's just that Nigerians don't like reading. We don't like knowledge. We just want to go on air, online, and then watch this, watch that, laugh, and then get away and come. Please spend time and read something and get knowledge yourself. It's available on the internet. Google has everything. So Google it and read. Fine, the symptoms may scare you, the complications may scare you because you'll talk about liver failure, talk about liver cancer and all those things. Those are extremes. But like I said, those who have it are living well, healthy. They are the ones, in fact, they're the ones that eat healthiest and they look freshest. Because you won't know. You've got it, it's fine. Enjoy your life. Live long, live well. Yes, many people are carriers who actually inherited it from their parents. At that point, they didn't know much about the vaccine and they are with it, but some are not even able to infect.
So for children who were carriers from maybe birth, at that stage, does it affect them throughout childhood or when do they...
They live with it.
They just live with it?
Yes, they live with it and they grow with it. In fact, a lot of women who are at the point of marriage, some may know, some it will be at the point of pregnancy. And when you go for antenatal, you run routine tests exactly. Some get to know at the point of antenatal registration. Some will even be at the point of marriage. I heard about some religious organization who request hepatitis B, not just HIV test. Fine. So at the point when they get to know, when you get to know, then do what is needful. And that's why I said if anybody is positive, put all the cards on the table for both of them. If they decide to continue, wish them well. They will be fine after all.
So the precaution for people who would like to continue in that scenario would be getting vaccinated.
Yes, get vaccinated. The person without it should get vaccinated and move on. And let the person who has it get treatment.
But you also have mentioned that it's not potent for, lifetime. And you are with this person.
Yes, they keep going for. That's why I said you keep going for booster
routine checkups.
Yes, routine checks and then booster doses of vaccination.
Fair enough. Well, you're listening to Solutions Clinic this morning. We're talking about hepatitis B virus, and Dr. Chukwuma Okoli is giving us quite an education this morning. I've received a couple of questions already, but if you would like to send in more questions, have the time this morning to do that. The number is 0904 422 2939. 0904 422 2939. I have a question here from Titulo. It says, good morning to you, Doc. I have taken 2 doses of my HPV vaccine in a hospital, but I moved to Ibadan recently. Does it mean I can take other doses in a hospital here?
Yes, you can. Just go, but preferably, like I said, government hospital. So you go there, discuss with them, inform them you've had 2 doses, and then let them know when exactly you took them, and then they advise you accordingly. But please go see the physician.
Are there like different brands, like COVID that had, different brands? Does it mean you have to stick to a particular brand?
No, we don't even know about the brands that there is for this one.
Oh,
we
fair
just go
enough.
there and say, even me, if I want to take it, I'll be like, I want to take hepatitis B vaccine. In fact, I won't even check. Most times you just be seated and they will call you, come in, and then you expose and they inject you and tell you that's all you can go. Not like COVID that people marketed and made money out of. Let's
Right.
leave that one go.
Another message here from Maiwa. Good morning, Doc. What would you advise? What advice would you give someone who has taken 2 shots but missed the third shot and it's been over a year?
Okay,
There's
now
you mentioned
it's
already.
similar.
There's a
Yeah,
time
it's
frame.
similar.
Yeah.
Just go back and then see the people at the government facility and let them know. They will still give you the booster doses, but they would first test you to be sure you are negative, and then you continue. So please just feel free to continue from where you stopped.
Olamide says, "Good morning, Doc. I know you didn't want to mention the price, but can you give us a range to prepare for? Assuming we know someone who is pregnant and has hepatitis B.
Okay, it's between 40 and 50. Okay.
Uh-uh. I was even thinking 400,
No, now, how
500,000. You know, you
about?
said expensive.
Yeah, it's expensive now. My
Actually,
guy.
this economy, that is actually
No.
expensive.
No. It's expensive. Somebody's
Honestly,
salary.
when you said I was thinking 400, 500,000.
No. It's
Ah,
affordable,
that's fair.
though,
It's
but it's still
actually,
expensive compared to how much people pay for delivery packages in
course,
some
no,
places.
it is. All right. Um, Good morning, Doc. I think that churches should actually include. Okay, this is more of an advice than a question. I think that churches should actually include hepatitis B virus as part of the routine check for married couple. That way, we can curb the spread of the virus. I totally support what you mentioned earlier. My name is Damilari. Sorry.
Okay.
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 Spiritual authorities. You've heard Damilari's voice.
Uh,
So when they come to you, I think it's just HIV and blood group and genotype. That's what it's usually required. I haven't gotten married, so I don't know.
HIV and genotype.
And genotype,
Mm.
you know, add that one to it, so we know what we're doing.
I support that too, so that we can reduce unless the people involved are ready to move on, please let them. But just lay all the cards on the table and inform them well, and let them know about the prospects and the consequences of their steps.
But you know, I mean, you've mentioned about other ways to contract it, but you've said the commonness is commonly through sexual.
Yes.
But this also happens, and you can't know how you got it. That's the sad reality. You can't know how you got it. But has there been cases? Have you had cases where someone who probably had it and you had counseling with them and they told you it wasn't via sexual activity?
Yes. I've seen someone who once mentioned, he said she nursed someone who was like, she was a primary caregiver to that person in the hospital. And after
Okay,
the person,
was he a health personnel?
No,
Okay.
just normal, like family member, so to speak.
Okay.
So after the person got well, she now came that she was ill and was brought to me, and then we realized that she had it. So we have to inform them while we run all those tests. We have to let her know, Ma, we found out this in your blood, and then she had to think, and she's widowed. Exactly, she's
Where
not
it came
been
from.
sexually active for a while. So the only road she could have gotten it from was probably the sweat of the person who had it then.
All right, another question here. Good morning, Doc. Please, what's the treatment option? Is it drugs or how do they get treated?
Okay, yes, it's basically, of course, oral medications. If they are just stable, they are plainly stable, it's oral medications, they go for it. There are medications that will be prescribed in the clinic, in the GI clinic for them, and then they live well. And then, of course, dietary control. Such persons, you let them know the liver is already at risk, so they are not a candidate for abusing paracetamol or just any drug anyhow. And then they are the candidates for taking fresh fruits constantly, vitamin C, supplements that will help build the system. Okay, there are also hepato, what I mean by that is liver supplements that, we call it hepatotrophic supplements that helps the liver to refresh and be much better. So they take them and then they live an healthy life, and then avoid excessive consumption of fatty foods and anything that can push the liver to the extreme. So,
All right. Well, thank you very much, Dr. Chukwuma Okoli, for such great insight on hepatitis B virus. You've heard this is not to scare threaten you, but to inform you so we can apply caution and precaution in your daily life. For me, and for everyone who thinks that it's also not, or it's also, or the major way is via sexual intercourse, you're absolutely correct. However, you've heard that. Surfaces, sweat, body fluids can lead to that. So you want to apply caution, and that's why he also reiterated the importance of getting hand sanitizers back and washing your hands regularly with soap and water. You borrow a spoon, please wash it with soap and water. Don't use tissue paper or serviette to clean it off, because the saliva can still be there.
Yes.
Saliva can still be there. Finally, is there any last words you'd like to say for this?
Okay, finally, we are in the rainy season, but that shouldn't stop you from drinking water.
It's not like anybody drinks swimming water, Doc.
The humidity reduces the desire.
Actually, the thirst for water.
Thirst and the drive
Oh,
to
that's
drink
true.
water.
I
But when
haven't
you
had
realize
water
that
today.
water is something that will do you 100% good. Exactly. So you drink it. You make it, at least at this season, 3 liters is not so much. That's the minimum you can consume. And 3 liters is 6 pure waters and 4 bottled water. So please drink daily. Your liver and your kidneys will greet you well.
You've seen that the liver also comes into play. So water is inexcusable for any human. So drink water this morning. Thank you once again, Dr. Chukwuma Okoli. It's always such a great pleasure and honor to have you share wisdom with us in the world of health. It's a wrap in Solutions Clinic this morning. We'll be back next week, Monday, with another subject in the world of health. I hope you have a wonderful, wonderful start of the week. Remember, like I always say, a healthy life is your ticket to a wealthy life. Good morning to you. My name is Vic Richards.
London. I got pictures on my phone of you. iPhone storage done they full. No one sees this side of you. I feel blessed, I trust in you. Midnight calls and rendezvous. I'm indecisive, but you I choose. So don't let me down, don't let you down. I feel so down away from you. Let's make babies. We're still young, but I did ready. Smoke some weed at the beach. I feel ease when I'm with you. Pretty Harris, free as God came through. You should see you from my point of view. They don't
Keep it 93.9.
Okay, now we are about to enter into a spiritual dimension. If you are ready, let me hear you say, yeah. Okay, I want you to clap like that. You do me wrong, I tell you God bless. My mama say make a pull up first. Pastor say make a